let's do care navigation first port of call. So when we were looking at contact numbers, I said there was the self-referral service care navigation first port of call. So if I press that, it leads you to this page. Now, the reason I made this page is to help reception staff redirect patients to self-referral services, especially when there's a lack of appointments or where the service might actually be what the patient needs rather than make an appointment to see the doctor. So if you have a look, again, this will take us to the A to Z service directory of all the services available. So if somebody needs to contact a help visitor or a school nurse, that will give them that information. I've put locality specific information on here too. So these people can be contacted. They will direct you to the particular nurse that you need. So we've got alcohol and drug addiction. It gives you information about the DISC service, and you can print out a patient information leaflet and the patient can self-direct themselves with a telephone number and exactly what the service does. Continence service, patient can ring that number. For example, you have a carer coming saying, I've got a problem with my husband or wife who's got dementia, I'm having difficulties with coping. So we've got these various places they can be directed to for support rather than seeing the GP. Again, if you click on, that will take you to the website. They can ring up that number, various activities that are happening. If you actually click onto this website, Dementia Friendly Barnsley, there's a lot of information, including, events that are coming up. Dentist in Barnsley, so you can put in your postcode and find out which dentist will see patients as an emergency. Eye opticians, I do have a list of opticians that do hearing tests. I'll add that onto the list. This list of pharmacies that are happy to consider giving out emergency hormonal contraception, self-referral to exercise health referral schemes. There's a form there that the patient can fill in and send in. This is detail about the family planning clinic and what kind of things they deal with, which pharmacies will give out flu vaccines. iHeart service, this is a really good website, Live Well Barnsley. So if we, for example, have a look at bereavement, and that will show you the various services available and where they are. Okay, mental health. Patients can contact that number, get more useful telephone numbers. And the Exchange Recovery College, which is on Gorba, and patients can again self-refer, managing depression, resilience, mindfulness, and it gives them information on how they can enroll. I've had a few patients who it's really helped. TADS. We've talked about the therapy for anxiety, depression, stress in 11 to 18-year-olds, especially with the long waiting list for CAMS. This is an alternative excellent service which is now moved to Queen Street. Now look at this minor ailment scheme. So I've made a list of the medical conditions that can be dealt with by a list of designated pharmacies. So all these things, patients can go to the pharmacy, receive a minor consult, and they can be advised on medications that can help with these, that can be bought over the counter. And people who don't have to pay prescription charges normally, they don't have to pay scripts here as far as I'm aware. These are a list of pharmacies involved, and there's a patient information sheet to give out explaining to the patient what this is all about. My Best Life, locality specific advices are here, and that's what we would refer for social prescribing. Here you can print out disease information leaflets if anybody wants to know something. So say for example, let's do tonsillitis. You've got the condition leaflets, and that's what you would want to print out for the patients. This is what used to be called patient.co.uk, and then you can print it out and give it to the patient. Phlebotomy service, so again for patients we can print out the time that they can go up to the phlebotomy service if our healthcare assistants aren't available or on holiday. At the social care website, when people say, I've got a family member that needs social service input, they don't have to see the GP. Now, sound doctor videos, I've put together a list of videos, say back pain. So these are the sound doctor videos available at present. Practice manager can give that code to the patient and they can then have access to the video. So that's for back pain, COPD, diabetes and dementia. For stop smoking, people can self-refer. Travel vaccinations, where people can go to. And this is a really important patient information leaflet that even admin staff can print out when patients need x-rays. Now this is just for a start. I've only put a few things down because I think sometimes less is more, and I thought once reception staff, admin staff, GPs, nurses get familiar with this list of self-referral services and patient information leaflets, then we can add some more. I've recently made a list of locality specific services, nurses, Macmillan nurses, diabetes nurses, community matrons, and I'll add that to the bottom. I'll add that to here in the near future. Remember, whatever services aren't here on this page, you can press the A to Z service directory and that will allow you to get to all the services either by alphabet, or if you press this switch to services by body system to this page, where if it's something for care of the elderly, you can just press that. In a few seconds, these are services that might be useful for care of the elderly, and you can just click on it and that will take you to more detail. You'll be surprised what kind of services there are in Barnsley. Barnsley is amazing. Now, let me take you back to the home page. So we've just talked about care navigation, first port of call. There's two ways of getting to it. Number one, just press there. Okay. Number two, it's there as well. I lied. In fact, there are three ways of getting to it. So that's second. And third, if you go down to the practice information box, it's there as well. But all three will lead you to the same page.